Pathologist found blood clots in almost every organ during autopsies on COVID-19 patients.
Here's a summary of the article.
Autopsies on people who died of the coronavirus are helping doctors understand how the disease affects the body, and one of the most remarkable findings concerned blood clotting, a pathologist says. Cleveland Clinic study, broken heart syndrome cases on the rise during coronavirus pandemic. Some COVID-19 patients are known to develop blood clotting issues, but the degree and the extent to which that occurs was described as dramatic by Rapkovich. In the early stages of the pandemic, bedside clinicians noticed a lot of blood clotting in lines and various large vessels, she said. And this was dramatic, because though we might have expected it in the lungs, we found it in almost every organ that we looked at in our autopsy study, she said. Notably in the heart, megakaryocytes produce something called platelets that are intimately involved in blood clotting. Researchers hope to discover how these cells influence small vessel clotting in COVID-19, she said. Autopsies have found a very low incidence of myocarditis, Rapkovich said.
This post received a score of 24,000, with an upvote ratio of 94%. Here are the top comments in response to this article.
This has been a theory for a few months now. People with adequate immune systems were suffering from organ failure in random cases, so it seems like the body overreacted to the virus and continued to send white blood cells. There have been cases of pregnant women having heart attacks and young healthy people experiencing the same complications. We still really don't know much about this virus, which is why it's important to shut down the armchair critics who claim it's nothing to worry about. We won't have accurate data on who it affects for another few years.
I am one of those younger individuals who contracted COVID and subsequently developed blood clots, pulmonary embolisms in both lungs to be more specific. I was in turn hospitalized for 5 days, 2 more than scheduled, as it was taking my lungs longer to accept enough oxygen than everyone had expected, which could be due to my asthma. For the next week I was fighting off the same pains all over again. I still have 1 more month of blood thinners until I'm evaluated to stop taking them.
What did the clots feel like? Was it pressure and pain in the chest? A tearing or clawing sensation? Did the pain move around?
You don't always feel blood clots moving, until it's a problem. Edit, stabbing pains, pressure does not mean you have blood clots, or potential heart attack. Precordial catch syndrome is a possibility.
The reasoning: many COVID patients are beginning to suffer other complications, liver failure, kidney failure, etc. These organs all filter tremendous amounts of blood for us. Thank you guys for commenting and keeping this discussion positive and informative. Best believe once this passes by we are going to fucking live it to the fullest.
Greater than other complications, liver failure, kidney failure, etc. And brain. Don't forget the neurological damage.
To be fair, blood clots go everywhere. It's just a matter of where they end up lodging themselves, destroying the thing they get stuck in: lungs, brain, kidneys, your leg if your name is Greg.
I need to stop reading the news to protect myself from my anxiety lol.
Yeah, exactly. Reading about all the side effects is making me extremely nervous. Best I can do is wear a mask and hope for the best.
Wear a mask except when alone, avoid other people when possible, after you didn't avoid other people, or even if you just touched things other people have touched, wash your hands thoroughly.
It sucks living with my family when I can't afford to move out yet. They hate masks because it's hard to breathe, and have traveled a couple times since Corona started to Mexico. My sister, who's an RN, ripped them a new one because of how careless they're being. I'm not sure if I can catch anything if they catch it first, but I'm pretty scared for my life. Something they would say is an overreaction.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.